Just sit right back and you'll hear a tale of a painful neck that started below the occiput, but not into the back. The patient was a mighty sailing man, a skipper brave and sure. He wanted to go sailing that day, but could turn his head no more. Could turn his head no more. The neck pain started getting rough. Rotation came with a cost. If not for the courage of a fearless PT, the rotation would be lost. The rotation would be lost. The PT set hands on the transverse process of the restricted side with Mulligan, the snag technique. The rotation with sustained pressure, increased range with overpressure and no pain, treated with Mulligan style.
Geez, my neck is really killing me. I really want to go sailing, but how can I go sailing with such a pain? I think I better go see this Mulligan guy. Maybe he'll help me so I can go sailing again. Hi, I'm here to see Mr. Mulligan for my neck pain.
Hi, I'm Marianne. He's expecting you. Let me tell him you're here.
Thank you.
Mulligan! Skipper's here to see you.
Hi there, Mr. Skipper. I'm Mulligan. Nice
Hi,
to meet you.
Nice to meet you.
Why don't we have a seat and we can talk about what's going on.
The first part of the Mulligan technique requires the physical therapist to complete a full examination. This includes a thorough patient history, systems review, tested measures, and forming a diagnosis, prognosis, and a plan of care. Important aspects of the exam includes passive range of motion, active range of motion, strength testing of the neck, and neurological and palpation skills.
Well, Mr. Skipper, after doing a thorough examination of your neck, it definitely seems as though you've got some pain and stiffness in a certain area of your neck that's preventing you from going sailing and doing other things that you'd really like to do. So basically, that area of your neck is called the C4 vertebrae. It's a bone within your neck, and it's coupled down from the back of your head. So basically what I think is there's a malalignment of the bones when you move, and that's kind of, being sticky at a certain point. So if it's okay with you, what I'd like to do is try out a treatment on you today. It's a manual technique, and you help me do it a little bit, and hopefully it'll decrease your pain and increase your neck range.
Okay.
One of the main ideas of the Mulligan technique is the concept of positional faults. Mulligan believed that because the joints aren't lined up correctly, they are inhibiting motion and causing pain. His idea was that if he provided a glide to this segment, that it would then allow the joint to move freely and without pain. It comes as an accessory mobilization with physiological movement.
Okay, Mr. Skipper, what I'm going to perform is what's called a snag. In PT terms, what that means is a sustained natural apophyseal glide. So in other words, I'm going to have to mobilize a segment in your neck and have you move with me in right rotation. We'll do this about 10 times for 3 sets. On the 10th rep, I'm going to ask you to provide overpressure. So at the end of your range, what I want you to do is take your hand and either put it on your chin or the top of your head, and just once we get to right rotation, really use your hand to push a little bit more towards right rotation.
Just like that?
Exactly.
Oh, that seems
I know,
pretty easy.
it hurts now, but it shouldn't be so painful when we do the actual technique.
Okay, let's do it.
All right, looks like we're ready for treatment.
We are.
Before going full force into a treatment, Mulligan performed what's known as a trial intervention. This is basically trialing a technique to see if it accomplishes pain abolishment and a significant increase in range. If these results don't occur, you can try changing your location, direction, or amplitude of force. The techniques are performed on the same side of the pain or restriction. Also, the techniques are usually performed in a weight-bearing position or the position at which the patient's pain is occurring. Another concept of the Mulligan technique is overpressure. It is essential that you describe, demonstrate, and practice overpressure with your patients. Most Mulligan techniques are performed in 3 sets of 10 reps. This involves the therapist getting into position and performing the glide. While holding the glide, the PT instructs the patient to perform their restrictive movement. In this case, skipper has restricted and painful rotation to the right. Therefore, Mulligan will perform the glide on the right side of the segment along the transverse process. The orientation of the glide is very important. Therefore, you need to know your facet joint restrictions and perform the glide parallel to this plane. In this case, the glide is up and forward towards the eyes. On the 10th rep, instruct the patient to provide overpressure.
Okay, Mr. Skipper, now let's give it a try. And remember, this should be pain-free, so please let me know if you feel any pain at all.
Okay.
All right, so I'm going to palpate down to that C4 vertebrae and then move to the right to the transverse process. All right, now we're going to rotate together. 1, 2, 3, 4, 5. All right, now provide that overpressure this time. 6, 7, 8, 9, 10. Good. Now we'll do that twice more.
Okay. Wow, that feels great. I haven't been able to do that for such a long time. Now I'll be able to see on the starboard side of my sailboat and can start sailing again. Thanks, Mulligan. You've made such a difference. Guess what? I'm gonna make it up to you and I'll give you a 3-hour tour on my boat, the Minnow.
That sounds great, Skipper.
Wow, the skipper's rotation looks great, doesn't it? Within the Mulligan practice, there are additional techniques and areas that can be carried out. These techniques can be performed on the rest of the spine and any other joints in the body. There are also a few other technique types. A nag, or natural apophyseal glide, is an oscillatory mobilization that can be applied from mid to end range. However, if the patient is extra sensitive, the glide can be applied at the beginning of the range. This particular technique works well with the elderly and acute patients. This is a gentle technique that's good to assess irritability. To perform the nag technique, the therapist places the middle phalanx of the 5th digit on the affected segment. With the opposite hand, the thenar eminence is placed over the middle phalanx. Gentle oscillatory mobilizations are performed in an upward diagonal direction towards the eyes. The pressure for the mobilization should be coming from the lower hand. This technique is recommended for 3 sets of 10 reps. A reverse nag is similar to a nag in that it uses oscillatory mobilizations from mid to end range. This technique is particular for stiffness and is especially useful in the thoracic spine. When mobilizing, the therapist should be moving the inferior segment. For example, if T9 is stiff, the therapist should be mobilizing T10. This technique is slightly more aggressive. The direction of the mobilization is also diagonally up towards the eyes. Make sure your forearm is parallel to the plane of movement. To perform the reverse nag, the therapist uses a grip that involves the middle phalanx of the 2nd digit and the thumb pad. These contact areas are placed on the transverse processes of the inferior segment. The opposite arm is wrapped around the patient to stabilize. Oscillations are performed in an upward diagonal direction. Again, these are recommended for 3 sets of 10 reps.